Welcome to Health Steps 24/7. I am Chris, your social media pharmacist. In this video, I will be talking about food poisoning. In addition to talking about the symptoms of food poisoning or foodborne illness, I will also talk about the causes of food poisoning, how to treat food poisoning, and how to prevent food poisoning. Make sure you watch this video all the way to the end because you don't want to miss any important information. If you have any other health-related topic you would like me to make a video on, feel free to put that topic in the comment section below. Become a health stepper. Walk more. Count those steps. Subscribe to Health Steps 24/7. Like, share, and comment on this video. Okay, let's get into this topic. So what is food poisoning? Food poisoning is a disturbance of the alimentary tract. The alimentary tract, also called the alimentary canal, is a part of your digestive system that consists of organs including your esophagus, stomach, small and large intestines, which makes up the route taken by food as food passes through your body from your mouth to your anus. This disturbance of the alimentary tract that causes food poisoning is caused by the use of food or drinks that is contaminated with bacteria or viruses or their toxins. Food poisoning can also be caused by parasites. However, in this video, I will talk about one of the most common causes of food poisoning, that is bacteria and bacterial toxins. So what are the symptoms of food poisoning? How do you know if you have been food poisoned? The symptoms of food poisoning include one or more of the following: diarrhea, which can be watery or bloody and severe; abdominal pain, cramps, fever, nausea, vomiting, dehydration; dry mouth, weakness, headaches, loss of appetite, difficulty seeing, and difficulty speaking. As I mentioned before, one of the main causes of food poisoning is bacteria. Some of the main types of bacteria that cause food poisoning include Salmonella, Clostridium, Staphylococcus, Listeria monocytogenes, Escherichia coli or E. coli, and Campylobacter. In this video, I will talk about three of these types or groups of bacteria. That is Salmonella, Clostridium, and Staphylococcus. In the next video, I will talk about Listeria monocytogenes, Campylobacter, and Escherichia coli. So make sure you watch the next video when it is published. Food poisoning caused by Salmonella is the result of eating food that is infected with the Salmonella bacteria. The elderly, young children, and people with weakened immune systems, for example, people with cancer, are most susceptible to the Salmonella bacteria. When food is eaten that has this bacteria, the Salmonella bacteria multiply in the body, causing symptoms including fever, headache, aching limbs, nausea, vomiting, and diarrhea. Usually, the symptoms of food poisoning caused by Salmonella bacteria starts 6 hours to 6 days after eating infected food and can last for as long as 4 to 7 days. Most people do recover from Salmonella bacteria food poisoning. However, in some cases, some people can become carriers and continue excreting the bacteria in their feces and at times the gallbladder, which can put other people at risk of infection even though the carrier does not have any symptoms. This type of food poisoning can be deadly, especially for the elderly, infants, and people who may have another disease or diseases. Salmonella enterocolitis or enteric salmonellosis caused by salmonella is one of the most common types of food poisoning. So what is the treatment for food poisoning caused by salmonella? What do you do if you get salmonella food poisoning? In most cases, rest and continual hydration, such as drinking extra fluid for as long as your diarrhea lasts, is all that is required. However, in some situations, you may need to be prescribed antibiotic treatment by your doctor if your case is severe, and you may also need to be hospitalized. If you do get salmonella food poisoning, it is best not to return to work or school until you have been symptom-free for at least 48 hours. And as much as possible, avoid contact with other people during this period. If you are a food handler working in the food industry and you do develop diarrhea and vomiting, it is best to advise your employer and leave the food handling area immediately. Now let's look at food poisoning caused by bacteria in the Clostridium group. Food poisoning that is caused by bacteria in the Clostridium group can be caused by Clostridium welchii, also called Clostridium perfringens, and Clostridium botulinum. Most species of Clostridium bacteria only grow when oxygen is not present. Clostridium bacteria have the ability to form spores that can survive in conditions including severe cold, boiling for up to 5 hours, heat, and dryness. For Clostridium welchii food poisoning to occur, a person must consume a large amount of the bacteria in food. It can take between 6 and 24 hours before the first symptoms of food poisoning occur after eating contaminated food, with symptoms lasting less than 24 hours. This is then followed by a rapid recovery. Diarrhea and stomach cramps are the usual symptoms of food poisoning caused by Clostridium welchii bacteria. Bacteria-released toxin in the intestine is believed to be the cause of the symptoms of Clostridium welchii food poisoning. Food poisoning caused by Clostridium welchii or Clostridium perfringens cannot be passed from one person to another and does not typically cause fever or vomiting. A person can become ill with Clostridium welchii food poisoning by eating meat and poultry in which the organism has multiplied during slow cooking or after eating cooked meat, pies, and stews that were previously stored in a warm room. So, what is the treatment for food poisoning caused by Clostridium perfringens or Clostridium welchii? What do you do if you get this type of food poisoning? The majority of people who get Clostridium welchii or Clostridium perfringens food poisoning recover without the need for antibiotic treatment. It is recommended that you drink extra fluid for as long as the diarrhea lasts. The other food poisoning causing Clostridium bacterium I will talk about is Clostridium botulinum. Unlike Clostridium welchii, which is common in nature, Clostridium botulinum, another toxin-producing or poison-producing bacteria, causes a rare form of food poisoning called botulism. Botulism affects the nervous system. The first symptoms of food poisoning in a person who is infected with the Clostridium botulinum bacteria can take a few hours to several days after eating food contaminated by the Clostridium botulinum bacteria to start. But typically it takes between 18 and 36 hours before the first symptoms of food poisoning start. The symptoms of food poisoning caused by Clostridium botulinum can vary. The symptoms can firstly be vomiting and diarrhea, then as time progresses, change to constipation, physical or mental weariness, lack of energy, and general weakness. An infected person can then have other symptoms including blurred vision, double vision, difficulty in swallowing, dry mouth, and difficulty in speech. Botulism is frequently deadly, and in cases where a person survives a Clostridium botulinum infection, recovery is very slow. If you are wondering if botulism is the most dangerous form of bacterial food poisoning, the answer is yes. A person who has symptoms of botulism food poisoning should immediately see their doctor or go to the ER or emergency room. What are some foods that can be carrying Clostridium botulinum bacteria? Foods that can be carrying Clostridium botulinum bacteria include home-canned vegetables, green beans, beets, potatoes, corn, as well as meat, fish, and fish products. So what is the treatment for this rare form of food poisoning called botulism? An antitoxin is used by doctors in the treatment of persons who have botulism. The antitoxin prevents the toxin or poison from causing further harm. However, while the antitoxin will prevent the toxin from causing further harm to a person's body, it does not heal the damage the toxin has already done to that person's body. A hospital stay, which can vary from weeks to months, may be needed depending on how severe that person's symptoms are. In some cases, a breathing machine called a ventilator is needed if a person has breathing problems and develop, for example, respiratory failure. In some cases, a person may need to undergo surgery to remove the bacteria or may need to use antibiotics prescribed by their doctor. Okay, let's look at staphylococcal food poisoning. Staphylococcal aureus or staph food poisoning is caused by eating food contaminated with toxins produced by the bacterium Staphylococcal aureus. The poison or toxin produced by Staphylococcal aureus is excreted or passed out into food. People who carry Staphylococcal aureus bacteria can contaminate food if they don't wash their hands before handling that food. Even though the staph bacteria may be dead or killed during cooking, the poison or toxin remains and causes food poisoning symptoms, including nausea, vomiting, abdominal pain, and diarrhea. Foods that are not cooked after handling, for example, ready-to-eat meat snacks, sandwiches, pastries, and puddings are especially risky if contaminated with Staphylococcal aureus. Unlike food poisoning caused by Salmonella and Clostridium bacteria, food poisoning caused by Staphylococcal bacteria begins shortly after using contaminated food and usually lasts for a few hours. Recovery from Staphylococcal aureus bacteria food poisoning is fast. How can you prevent bacterial food poisoning? What can be done to avoid bacterial food poisoning? Foods, especially whole poultry and beef roast, should be cooked to a safe temperature. Examples of foods and what would be considered a safe temperature or way of cooking are whole chicken, chicken breasts, legs, thighs, and wings cooked at least 165 degrees Fahrenheit or 73 degrees Celsius. Eggs cooked until yolk and white are formed. Egg dishes, for example, omelette and quiche, cooked at least 160 degrees Fahrenheit or 71 degrees Celsius. Fish cooked at least 145 degrees Fahrenheit or 62 degrees Celsius, or cooked until flesh is opaque and separate easily with a fork. Leftovers should be cooked at least 165 degrees Fahrenheit or 73 degrees Celsius. If you are not going to serve or eat food shortly after the food is cooked, store your food at 140 degrees Fahrenheit or 60 degrees Celsius or warmer, or 40 degrees Fahrenheit or 4 degrees Celsius or colder, since bacteria can multiply if food is left at room temperature. Or in what is called the danger zone, that is any temperature between 40 degrees Fahrenheit or 4 degrees Celsius and 140 degrees Fahrenheit or 60 degrees Celsius. All leftovers should be refrigerated at 40 degrees Fahrenheit or 4 degrees Celsius or colder. Leftovers should be refrigerated within 2 hours after cooking the food or after removing the food from an appliance that is holding the food at a safe temperature. If the outside temperature is above 90 degrees Fahrenheit or 32 degrees Celsius, you should refrigerate your leftovers within 1 hour after cooking the food or after removing your food from an appliance that's holding the food at a safe temperature. In case you are wondering whether it's okay to put hot foods in your refrigerator, the answer is yes. It's okay to put hot foods in the refrigerator. However, if you prepared a large pot of food such as soup, stews, and meat, you should divide the food into small quantities before putting the food in your refrigerator. Doing this helps to cool your food fast enough, which prevents bacteria from growing. If you preserve, can, or ferment your own foods, you should follow safe home canning instructions, for example those recommended by the U.S. Department of Agriculture in the USDA Complete Guide to Home Canning. This includes instructions for washing, cleaning, and sterilizing items used in the canning process. If you make oils at home that are infused with garlic or herbs, you should refrigerate any oils you did not use after 4 days. Any canned or pickled foods should be refrigerated after opening. If you bake, for example, potatoes wrapped in aluminum foil, keep those baked potatoes at 140 degrees Fahrenheit or 60 degrees Celsius until served, or make sure you refrigerate those baked potatoes with the foil loosened. Thanks for watching this video. If you enjoyed watching this health education video, go ahead and smash that like button. Feel free to comment, share, and subscribe to this channel. Join me next time for more health videos. Bye for now.